Ultimately, if you made it this far, congratulations, and you made it this far for a reason, and you're going to do great on your rotations and working with patients. Remember that they are also real people, and so talking to them about real people things is always a great place to start whenever you get uncomfortable. Hello, my name is Hailey VanRonzelen. I am a current fourth-year medical student at KCU-Joplin. I am currently doing my audition rotations in emergency medicine and internal medicine. And thanks for inviting me on this episode of your Guide to Doing Med School, presented by the YPN and MAOPS. So today I wanted to talk to you guys about rotations. And of course, these are just my own experiences and my own opinions that I've come across after my time rotating as a medical student. So first, I want to talk about choosing your rotation site. So this is something that's very unique to DO medical students, and I know that the two different medical schools do this very differently. So I'm from KCU, and how we do it is we are presented with a website that has links to all of the different rotation sites. You can read previous student reviews, statistics about the hospital, but you don't actually get to talk one-on-one with people who are there or anybody involved with the rotation site as a whole. I know ATSU, they get to have these meet and greets with the regional assistant deans and get to have a better understanding of what the environment is like at that site before starting the application process. So how do you know what is important to you for rotation? So I can only speak of what was important to me, and that was having a close access point for me to get in touch with friends and family. And so I looked at the list of all of the rotation sites and kind of made a pros and cons list of what friends and family we would have in the area, the closeness to airports, or, how close it was to be able to drive to different attractions. Also, what the community offers. Something for me that was really important was finding a place that had, a lot of different workout classes, because that's how I relieve my stress. Other people I know had a big impact of the cost of living of that area. And so, big city versus small town, how much you would have to take out in loans, or if you're not doing loans, and kind of taking that into account. So you really have to kind of sit down with yourself and any family or partners that may be coming along with you and have an honest discussion about things that you prioritize. Another thing that you could take into consideration is what specialty you think you want to go into. This isn't quite as important for some of the more family medicine, internal medicine-based programs, but for some of the more competitive programs that are out there, having a site that has access to residency programs or another way to get you closer in contact with people who, have a bigger say in that environment is something to take into consideration as well. That being said, just because you are at a site that is a smaller or more rural site that doesn't have a certain program does not mean that it is impossible to match into a more competitive specialty. And if you are at KCU, I know that you can take kind of all of these lists and then use it for your letter, which is a letter that you would then write trying to plead your case to the site director of that rotation program. You can also write additional letters on top of that, which I'm not going to get into today, but these are all great things to kind of include to try to plead your case. I am not sure if ATSU gets that opportunity as well, but as far as the actual lottery system, I believe that's pretty similar between both schools in Missouri. And so at KCU, we submit a rank list of where we want to go, and then they take that into their system and then publish a list a couple of weeks later, usually around mid-February, kind of announcing where we get to go for our third and fourth year rotations. So now I want to take some time to talk about rotation advice kind of as a whole. And of course, these are just my own experiences and my own opinions that I've come across after my time rotating as a medical student. And so the first piece of advice that I have is just to be yourself. I know you're going to hear this from everybody who you come across. I tried to be what I thought was a really good student, quiet, take notes, just kind of follow what everybody else was doing. But that is not at all who I am. And so once I was able to kind of move past that, especially a couple days into each rotation, I got along so much better with the doctors, nurses, technicians, and made friends with, most of the people at my site as a whole, which made the rotation go by so much better. So don't be afraid to kind of be out there and be yourself and step up and speak up whenever you have an opportunity to, and, don't be afraid to make friends. The next piece of advice that I want to give you is to go into each rotation with the mindset that this is what you want to do with the rest of your life. Somebody had given me this piece of advice before I started rotations, and I wasn't a big fan of it at the time. But actually looking at the AAMC, they cited that almost 75% of medical students who go into medical school thinking that they want to do one specialty end up coming out of it wanting to do something completely different. And interestingly, actually 20% of residents end up switching their specialty before graduating from residency. So for my part of the story, I walked in the first day of my rotations to my elective in the emergency department, thinking that this is what I want to be whenever I graduate from medical school. And I spent the whole day, dove right in, and I came out absolutely loving what I was doing. And then I thought to myself, this has to just be the difference between second year and third year, and what everybody was talking about how much they enjoy their third year rotations compared to their didactic years sitting in medical school. However, I walked out of my first month of rotations thinking I want to become an emergency medicine physician. I then started my second rotation as internal medicine and had that same mentality of this is what I want to do with every day of the rest of my life. And I actually kept coming across things that made me think, maybe this isn't exactly what I want to do. And I just continued to use this mentality to take myself through each additional rotation I had throughout my entire third year. And at the end of the day, I feel like that made it a lot easier as a fourth year student coming up and making my own schedule, thinking about things that I really enjoyed and things that I didn't really enjoy. I kind of had made myself think about that along the way and kind of write those things down, making it easier for me to decide, you know what, I really would be more interested in learning more about this, or you know what, I really did not like this aspect of this specialty, but maybe I might like this. And so I really recommend just having a complete open mind and, making sure that you go in with this really open mindset of, is this something I can be just seeing myself doing? The next piece of advice that I have is that no matter what your printed schedule says, you are not on a clock. I had a couple of classmates who really struggled with this, and I had a lot of preceptors tell me horror stories about medical students who thought that they were able to kind of clock in and clock out based on the schedule that they were given and not just doing whatever their preceptor said. And so one of them was a surgical preceptor who had a student who had decided that the schedule said that they left at 5, and so they had walked out of surgery one day early on in the rotation at 5 o'clock on the dot, saying that their time was done and that they were going to go home. And I heard later on that student failed that rotation because of that. So make sure that, there's not really a set time schedule for anything that you do. You're going to get there early, you're going to stay late, you're going to do overnights, weekends, and you're going to be on call. So just understand that's something that you kind of signed up for, and you don't really get to choose your schedule. I also had another student who rotated with me on one of my rotations, and he would just go missing for hours at a time, and our preceptor would say, "Oh, Hailey, where is so-and-so?" And I would be in the really uncomfortable position of not knowing where he was and also not wanting to throw him under the bus for just not showing up to rotations. And so just something to keep in mind that you might also put some of your colleagues in some uncomfortable situations as well. My next piece of advice kind of comes on the same idea, and that is that you should go in being really eager. And I kind of have two stories to tell about that. The first one was that on my OB-GYN rotation, I became friends in labor and delivery with all of the nurses as well as all of the OB-GYNs, and actually ended up delivering a baby with each individual OB-GYN instead of just the one that I was assigned to. And so actually I was able to attend 14 deliveries and catch 14 babies during my month, which was far more than anybody else that I had been with. And it gave me some really great experience and kind of allowed me to go over the top and kind of get some of those good, reviews and letters of recommendations about my eagerness and how excited I was to be involved. And I actually greatly enjoyed it. I had another really similar experience whenever I was on internal medicine, and that after we presented on our patients, the rest of the students and the residents that I was working with actually went back downstairs to work on their notes and to study and things like that. And I actually asked the attending if I could just round the rest of his rounds with him and then also help him with any admissions. And I was able to spend one-on-one time with that attending and get to see things that I otherwise wouldn't have got to see. And I think it made me really stand out to that attending. Of course, with this, you can always be eager, but you have to be able to take no as an answer and not argue or be upset about that. And so just something to keep in mind if you struggle with rejection. And then my last piece of advice is to start asking for letters of recommendation early. I did not follow this advice and then was really struggling whenever it came time for me to ask for letters for Vislo and for audition rotations, as well as for my residency applications of trying to get those letters of recommendation in on time. So I would just start asking early, especially if you have some of these interactions with staff and some of your preceptors while the experiences is fresh in their mind. I would take advantage of that.
You're listening to YPN's Guide to DOing Medical School. This podcast is hosted by the Young Physicians Network of MAOPS, the Missouri Association of Osteopathic Physicians and Surgeons. MAOPS has been the voice of osteopathic physicians in Missouri for the past 125 years, advocating for the osteopathic profession at the local, state, and federal levels. This podcast is created for students, by students, to help with the unique struggles of medical school, tailored to the osteopathic experience. Have a topic that you would like to hear about next season? Let us know at our social media pages. Instagram at DO_MAOPS and Facebook at Missouri Association of Osteopathic Physicians and Surgeons. This is YPN's Guide to DOing Medical School.
And that brings me to my next topic, which is electives. I know that this is something that's very different based on your school and your rotation site. And so I'm just going to kind of go off of this based off of my experience, but obviously this is different for everybody who goes through this process. And so for me, I was emailed by my regional assistant dean a couple weeks before I started my rotations asking what electives I wanted to do. I didn't get a list. I was just told, hey, what are you interested in? I'll try to put it into your schedule. I know some of my ATSU student friends weren't allowed to do any electives until the end of their third year core rotations were done. And I think that that's completely fair because the thought process for this kind of goes similarly with your fourth year schedule and how you kind of think about that. And so my thought process was I thought about what I wanted to do and what kind of things would be adjacent to that. So, for example, when I started my third year rotations, I thought I wanted to go into ICU medicine. And so I thought, what's similar to critical care? So I had asked to do emergency medicine and anesthesia, thinking, okay, I can get some procedures, I can intubate some patients, I can kind of get an idea of what the doctor thinks about as they go through tasks that I might see and do in the ICU. And this is where you can get kind of creative. So if you are interested in internal medicine or family medicine, you can do almost anything, and that's really applicable to your future career. However, if you're more interested in surgery, maybe you should look at doing a rotation in wound care. Or if you're interested in doing something related to OB-GYN, maybe look at a lactation consultant or working with a maternal fetal medicine specialist. You can also take this to think about what you might want to be better at that might help you at what you want to do in the future. And so, for example, for me, this meant I wanted to do a rotation in cardiology to be better at reading EKGs and getting an idea of what to look at when I was reading an echo. I also wanted to do a radiology rotation to get better at learning how to read scans. If you're interested in emergency medicine, orthopedics to learn how to do reductions and splinting. So this is a great idea of ways just to kind of get out of the box and think about things that might help you in what you want to do in the future or things that you might want to learn about. And the best way to get ideas, I would suggest, is just talking to other students who might have had other experiences if they were at different sites or people who were in the year or two ahead of you and kind of what they would recommend. For me, this was the exact same mentality I took with me to my fourth year rotations. And with that in fourth year especially, you can travel and meet different patient populations. For example, if you're really interested in psychiatry and addiction, maybe you want to go to West Virginia and see if you can get an audition in doing something related to addiction. Or if you're interested in hematology, going to Chicago and learning about sickle cell patients. One caveat here is I want to mention neurology as a rotation. So I know that the DO schools in Missouri do not have this as a required rotation, but a lot of rotations that I came across in Vislo actually had this as a requirement in order to do your rotation there. So obviously I just told you that you're probably going to change what you want to do as a specialty anyways, so it's really hard to keep in mind what specific rotations are going to need this. I would recommend that if you want to do something competitive or if you are really confident in wanting to go to the West Coast, I would recommend doing a neurology rotation. Now, for my last piece of advice related to electives and your fourth year rotations, I would just want to mention that on almost every rotation I've been on, especially rotations that I've gotten to choose for myself, such as electives and auditions, I have always asked what I hope to get out of this rotation. And so I recommend at least a day or two before you start your rotation, just taking a minute or two to think about what your answer to this question is going to be. For some, that's really easy. You might want to do a plastics rotation to learn how to do sutures, or you might want to do your cardiology rotation to learn how to read EKGs. But sometimes this is a much harder answer. So just something that you should keep in mind before you show up on your first day, because my attendings have always asked me this question. Now, the last piece of advice that I want to touch on is resources that you might need for rotations. I know that there are going to be future podcasts on this later, so I just wanted to get in some quick recommendations that you might need now before you start these rotations in the upcoming weeks. The first is the surgery recall book. This has a lot of pimping specific questions for each type of surgery. It is great. I read it before any case that we had that was similar to that, and it came in very useful. So I highly recommend that you or your rotation site gets a copy of this that you guys can kind of share. You don't really need it outside of that. I don't know that it would be super helpful for studying, but as far as performance before a case in the OR, I highly recommend Surgery Recall Book. Another book that I recommend that you buy before you start rotation is Pocket Medicine. This specifically is for internal medicine rotations, especially inpatient. We use this daily. It was really easy to get out. Usually my preceptors would directly ask questions from it and ask us to turn to the page about that in the book and kind of go through it with us. So this was very helpful for me. I have brought it on all of my audition rotations. It's really nice just to kind of have in your white coat pocket and be able to pull out and have quick answers that are from a decent source. They have these for a lot of specialties out there. I actually have multiple different copies for a lot of different specialties that I've rotated in. The one I used second most after my internal medicine one was the Pocket OB, especially because it's so hard to find really reliable sources for pregnant patients and things that you should and should not do for them. Of course, also having websites that you can always look things up on your phone quickly. I highly recommend Open Evidence. I had a lot of preceptors who use this as well. I also recommend having Amboss or something similar to that, Epocrates, something where you can quickly type in something and get answers. I also always had UpToDate on my phone, but a lot of times the subscription would run out or you'd have to kind of choose the right page, which wasn't as easy to do as it was with some of those other applications that I just mentioned. I will also briefly touch on what I did to study for my shelf or COMAT exams. So I made sure that I was doing practice questions every night, usually from TrueLearn and UWorld. And then made sure that I got through all of the questions before I sat for my COMAT or my shelf. Honestly, this is all I really did to study. I didn't have a lot of time outside of rotations to do any other studying or reading of any resources or watching of any videos. I know some people still used Anki and things like that. That was never something that ever had worked for me in the past, and not something I tried to take on during my third year. And ultimately, if you made it this far, congratulations, and you made it this far for a reason, and you're going to do great on your rotations and working with patients. Remember that they are also real people, and so talking to them about real people things is always a great place to start whenever you get uncomfortable or even just need a minute to gather your thoughts.